Hi, everyone. As everyone is joining, we are so happy to have people waiting for us or waiting. See, I see waiting. The words I'm transposing. Hello, everyone. My name is Rachel Lieberman. I'm a director here at the Celiac Disease Center. We are so excited to have you this evening. We're looking at this as our part two of unraveling additional GI disorders. We have three fabulous dietitians with us from the University of Chicago, and I want to welcome them really quickly. But alongside me this evening is Dr. Ritu Verma, who is our medical director of the Celiac Disease Center. And I'm so happy to have her co-host this program with us tonight. But without further ado, I want to introduce our fantastic dietitians who are with us. And that is Vicki Gainsberg, who is a pediatric dietitian here at Comer Children's Hospital, as well as Audrey Rowan, who is also a pediatric dietitian at Comer. And we have Lori Wellstead, who is with us at the University of Chicago Medical Center. She is an adult dietitian. All three of these fabulous women specialize in celiac disease. And I am really excited to dig into this really important topic of other associated GI disorders. What I would like to say is this program, I want to go through a few housekeeping. This program is getting recorded. We will post it on our YouTube channel. We have a Q&A function at the bottom of your screen. It would be fantastic if you can put questions. I know some of you pre-submitted questions. We will be doing that. We'll be addressing those questions. We will have time for a Q&A. And I wanted to just also share that please keep yourselves on mute. And because we are pre-recording this and we'll be posting on YouTube, we just want to make sure that our speakers can be seen. Dr. Verma, before I get started, I just want to see if you have anything to say.
I just want to say thank you so much for joining us. Thank you for all your questions, the engagement, and we're going to let Lori take it away from here. Lori.
We are. And Lori, give me 1 second. I just saw your note.
Okay, great.
I'm going to enable Lori to share her screen. I apologize, everyone. 1 second. What? Sorry, everyone. I hope everyone's having a great day. Lori, I'm going to make you a host, and I am really hoping.
Yeah, it should work up here.
Then that way you can share your screen. You guys, no matter what, we do our best with technology, and it surprises us every time. So I apologize, but we're going to get started in 1 minute. And Lori, we see you.
Okay. Hello, everybody. So again, thank you everyone for coming. We're going to have Audrey start off tonight. And again, we'll be speaking on some additional things we spoke on the other day. And we titled this Celiac Disease Nutrition Unraveling Additional GI Disorders.
Thank you. Good evening, everyone. Thank you so much for joining us. We're really happy you're here, and we hope that we can shed some light on some very confusing dietary issues that arise with celiac and maybe outside of celiac. You know, we're here for it all. But essentially, what we're looking at in this presentation is the gluten-free diet basics, right? The gluten-free diet is the only known treatment for celiac disease. And sometimes we have ongoing symptoms of GI disorders despite staying on a gluten-free diet, which, one word, frustration, right? It's like, what am I doing wrong? How can I improve it? Is this, and what we want you to consider as we're going through this presentation is it's very important to have regular follow-ups with your GI team. What we have is a gastroenterologist and a dietitian. We're both regular parts of the celiac team because the diet is the treatment. And what's important to consider from there is, are we also potentially looking at irritable bowel syndrome or irritable bowel disorders of some kind? Are we getting enough fiber in the diet? Because the gluten-free diet is notoriously low in fiber. And what kind of lifestyle factors could be interfering with proper digestion, again, despite being on that gluten-free diet? Lori, can I get a click? Thank you. So as everybody knows, I mean, this beautiful croissant is just the epitome of all things gluten. Oops, one more back, please. Thank you. But fun fact, actually, I thought this was interesting. It's the word gluten is actually derived from the Latin word for glue, meaning that the structure gluten provides a lot of breaded items, right? It provides structure, texture. When it bakes in the oven, it rises and then it shrinks back down. The gluten strands in the protein as part of the structure of that bread or wheat item, it's brought back down because the structure of gluten is holding it together. When you're finding alternatives for those baked items, they're going to be lower in fiber. They're going to be made from things like potato, corn, stuff that's not really going to hold quite as well together. Can still be delicious, right? But it's important to remember that the structure of the food that you're eating, if you started on a gluten-containing diet, found out you have celiac disease, and now you're going to a gluten-free diet, the structure of your food is different, and therefore your digestion is going to look a little different. But again, wheat, rye, and barley are the big no-nos in celiac disease. You avoid these, you avoid them in cross-contact situations. And you want to remember that these are considered toxic in celiac disease. They will induce an autoimmune reaction. And the key is to avoid it as much as humanly possible. Next slide, please. Thank you. So going off of the avoiding wheat, barley, and rye and all foods derived from these grains or even baked on the same surfaces as these grains, right? Only oat and oat products that are certified gluten-free is what we recommend. I know oats are kind of a field mine situation. You know, there's a lot of opinions on the internet about it, but what we recommend is oats that are certified gluten-free, meaning there's very little risk of cross-contact in the production and packaging of these oats, because of course they can have different products fall in the containers as they're getting packaged. They can have wheat products from separate fields blowing in. So certified gluten-free oats ensure that cross-contact is kept to a bare minimum and it's within safe reason for people with celiac to consume. That being said, of course, when in doubt, leave it out. But the goal is to learn more. The more we know, the better we can do, right? And especially if you're someone who is just starting off with celiac disease, the diet education that comes with it is so overwhelming, right? You can't learn celiac in 1 hour. You can't learn it in a week. Sometimes you can't even learn it in a year. But the important thing is to learn and apply it to your life and to have regular follow-ups with your care team to be sure that you're making it work the best you can. Next slide. Thank you. So when it comes to irritable bowel syndrome, I mean, it's a very kind of broad, it can sound like a very broad diagnosis. Well, I have trouble going to the bathroom. Well, okay, when does it become occasional constipation or diarrhea or something else versus irritable bowel syndrome? We've gone through a couple of different diagnostic criteria throughout the years. Rome 4 is the 2016 criteria. That's the most recent criteria we've gone on. And it recognizes recurrent abdominal pain for at least 1 day a week consistently over the last 3 months with at least 2 or more concerns related to either defecation, having regular poops associated with a change in frequency of stool. Are we going more? Are we going less? And a change of form of stool. And lucky for you, this is GI. So there's a lot of crap talk. Both related to and not related. No, just kidding. But when it comes to your poop, I mean, as funny as it is, we can tell a lot about someone's health based on what their poop looks like. When we're not really seeing red flags associated with irritable bowel, we're thinking of weight loss, you know, any bleeding coming from your rectum specifically. Is there a family history of cancers or irritable bowel, maybe unexplained changes to your lab values or significant exam findings, right? So these are just some things to consider. Just because you have celiac and now you've gone on a gluten-free diet, say you're having one or more of these issues, does it mean irritable bowel syndrome? Not necessarily, but it's important to keep these in mind as you're bringing your symptoms forward to your care team in your regular follow-ups. And when it comes to irritable bowel disease and celiac disease, the two, again, the symptoms are so similar, right? So what comes first, right? But when we're looking at studies discussing the co-occurrence of celiac and irritable bowel syndrome, we are finding that they're correlated, right? So irritable bowel syndrome is nearly 5 times more likely to be diagnosed in those with celiac disease versus, a regular control group, right? And the prevalence of irritable bowel is, pretty common worldwide. It's 10 to 15% of the entire world's population. So it is more common as well than celiac disease itself. So again, it's like, what symptoms are related to irritable bowel and what are related to celiac? The challenge for us to figure out is to not only listen to you, to our patients, to understand this particular symptom started here, while this particular symptom started here, and maybe it occurred with this, but not this. That's what we're teasing apart as you're telling us what your symptoms are like. And things that we're really going to look at, things that we can control right off the bat, right, is diet, of course. So are you really sticking to the gluten-free diet and avoiding cross contact? How often are you eating out? Have you traveled recently? Travel can interrupt a lot of regular bowel movements that are habits related to having bowel movements that maybe got disrupted. A big one to also consider is stress and anxiety. And I always feel like I'm asking so much of people. It's like, you're diagnosed with celiac and now, okay, you got to follow the gluten-free diet and avoid cross contact and learn how to label read and make all your doctor's appointments and don't stress out. But it is really important as you're dealing with chronic GI conditions, the brain and the gut are connected. And when one is suffering, the other could in turn experience problems as well. So stress management, regular exercise, are we managing anxiety? And do we need to bring in another team member to manage? Absolutely possible. All things to consider. Next, please. And with that, I get to hand this lovely chart off to my colleague, Vicki Gainsberg. Unless she doesn't. There we go, Vicki.
Okay, Audrey, I'm sorry, I thought you were doing this slide.
Oh, I am? Oh, I can. Great. Awesome. See,
but I could do it if you want.
No, that's fine. I miscounted. See, we got it all together except for the number of slides we're doing. Just kidding. I get to do this one. I'm glad because it's my favorite. This is a Bristol stool chart that we use in our day-to-day to figure out what does your poop look like. Sorry, we got to talk about it. Right? So it ranges anywhere from 1 to 7. The ideal range that you want your poop to look like is type 4, where that lovely little smiley face is. So either a sausage or a snake, really soft and smooth. It comes out easily. There's no blood or mucus or any foreign material associated with it. There may be some undigested food there, but the important thing is it's not painful and it comes out in one cohesive blob. Type 3 is also okay. It's usually sausage-like, but like with cracks, almost like a corn on the cob. That one is okay too. So anywhere between a 3 or a 4. The more we get into the type 1 range, the hard lumps, right, kind of like cannonballs, that's when we're looking at constipation, usually related to either a lack of fiber, a lack of water, or both. And if we're going down all the way to type 7, we're looking at pretty watery diarrhea, can be a common symptom of irritable bowel, or it can be changes in your diet, changes in travel, anxiety, these factors that can play into how our bowel movements are moving through our body. So again, this is what we're going to be asking you in appointments, and it's good for us to know if we ask you to go home and take a food diary or a bowel movement diary for a couple days. This is the kind of stuff you need to be looking in the toilet before you flush. Or if you're a parent of a child with GI disorders, look in the toilet before they flush it, because this can really tell us a lot about what's happening inside their body, what nutrient deficiencies they could be missing, and how we can benefit their diet overall. All right. And this one was you, right, Vicki?
Okay, yes, now.
There we go. I'll hand it off to Vicki.
Hi, everyone, I'm Vicki again. So I am going to start my part talking a little bit about diet therapy and IBS. So I just want to back up a little bit. I know Audrey had mentioned some great stuff about, crossover between celiac and IBS. And, starting on this, gluten-free diet, getting diagnosed with celiac, you're on the gluten-free diet, there's a lot of symptoms that overlap with IBS and celiac. So, bloating, gassiness, diarrhea, constipation. So you start the diet, you're starting to feel better, or maybe you've been on the diet for a long time and you feel like pretty confident, gluten-free, numbers look good. So, sometimes we have to just look outside the box and we're still having some symptoms because it might not always be gluten related here. So there are other well-known diet triggers that can cause things such as IBS. And so, there are a lot of diet therapies that can help with this. So, number one, this is more cost effective because we're not dealing with, medications. We want to try to seek, a more holistic approach to this and try to find, if there are other possible food triggers or other things, as Audrey mentioned, anxiety related too, that can occur with IBS. But typically with diet, we really want to make sure that there is, fiber, good fiber in the diet. Is fiber we're not getting enough fiber oftentimes on a gluten-free diet. Sometimes starting it, we're not getting enough of those gluten-free grains that are, high in fiber. We're choosing a lot of those low fiber grains. But if you are following a good naturally gluten-free diet, you can get really good fiber. And we'll get into that in a little bit. Are you drinking a lot of caffeine? We know caffeine is related to IBS. Also alcohol and, nicotine. These things can trigger symptoms. Meal size, are we eating really large meals? Sometimes we go all day and don't eat, and then we gorge and eat really a lot at night. And, overeating can also cause, some of these symptoms in IBS. And then there are other foods that, we know that are well known that can, trigger symptoms. One thing that, Laura will get into the FODMAPs, but there are these certain foods, these are fermentable carbohydrates that we are known to can cause some symptoms. Oftentimes they're harder to break down. These sugars, they're all different fermentable sugars. And sometimes they can lead to, again, this gas, bloating, diarrhea / constipation. But again, no one diet fits all. This is why it's important to seek, the professionals to help manage this. See what else is going on. Why are we still having these symptoms? Because, we don't want to, we want to feel better. We want to get, find the answers sometimes. Next slide. So let's talk a little bit about fiber. So fiber is really important, and we really want to try to get a good variety of different fibers in the diet. And we can get it naturally while following a gluten-free diet. It's not like it's something we gotta, find, if we're on the gluten-free diet, we can't get enough fiber. And absolutely, we can get fiber in. So there's insoluble fiber and there's soluble fiber, and they work in both these different fibers work in different ways to help our stools become what Audrey said is ideal as the 3 and the 4, making them help with the roughage. They help bulk the stool up. They help with transit time, minimizing the constipation. And then it shows insoluble fiber comes from various grains, fruits, vegetables, dried fruits, and so forth. And then the soluble fiber also helps with transit time, and it also attracts that water and making those stools good, well formed. And these also come from different beans, oats, different fruits, and so forth. So we really can get the fibers, both insoluble and the soluble fiber, on a naturally gluten-free diet. And again, when we are starting gluten-free diet and the fiber might not be sufficient enough, or we might not be getting enough because we're worried, or we're maybe eating a lot of, refined fibers that come from rices and potatoes and stuff like that are found in a lot of these gluten-free foods. We really want to try to get that fiber in and increase it gradually, because sometimes overloading our body with fibers at once too can also cause, again, these adverse GI, symptoms such as, the bloating, the gassiness, and so forth. And then we also want to look at, I just want to mention some of these gluten-free, nowadays there are a lot of breads and cereals and grains that sometimes have a lot of extra fiber added. I have celiac, and I read a lot of labels and ingredients, and some of these breads nowadays are like, these companies are adding some of these fibers coming from food, from different grains and foods that sometimes we can't sometimes digest well, as and some of them have maybe 6-8 grams of fiber, which is a lot. So we have to consider that too, the amount of fiber we're getting in a session, in a serving, or in a meal. And we don't want to overdo it either, because that again can cause adverse reactions in our body. Okay, next slide. So as we can see here, this is a great slide because sometimes people, feel like sometimes vegetables can cause problems, raw vegetables, or, various forms of vegetables or fruits, but we can get them in different styles and still get that fiber in. For instance, you see this pureed veggie soup or a fruit smoothie or pureed beans. So these, you're still going to get the benefit of the fiber, but it's easier on the gut, easier. We don't have to work as hard our bodies. So we're still getting that benefit, but sometimes it improves those side effects, those symptoms of maybe that bloating or the gassiness. As you can see, you move forward to more of the cooked vegetables. These again are going to be a little more easier to digest versus like all the raw stuff, the raw veggies. Some of these cruciferous vegetables, side effects are gassiness. Fruits too, they have a lot of a sugar called fructose, which we'll get into in a little bit. So overdoing on sometimes the fructose can also be a little bit cause some of these symptoms. And then if we move down to like beans again are gassy. So, just being careful sometimes with overdoing it in one serving with some of these foods too, and being more mindful, sometimes starting a food diary, seeing, I'm following the gluten-free diet. We know it's not gluten, but what else is causing this? And it's not, there's not, again, one specific thing, that can be causing it in everybody. Everyone is individual and it's very specific to each person. Next slide. So next we're just, I just like to put this slide in. It just shows like, balancing out the gluten-free diet. This is so important, that we get, we can follow, a naturally gluten-free diet and get all the good nutrition in, fruits, fresh, frozen, canned, fruit juice, I try to limit those because those are going to be higher in sugar and a little more higher in fructose, but dried fruit, these are all good sources of, different forms of fruits, veggies too, and all obviously gluten-free, different forms of vegetables, proteins, you can get them from both, meat, animal sources and plant-based sources, all, a lot of very naturally gluten-free ones, grains. So these are really, here we're focusing on some of these really good fiber-rich grains, amaranth, quinoa, buckwheat, teff, rice, brown rices, and the wild rices. And these all are really good whole grains and again, good source of fiber. And then we also want to, make sure we get our calcium in our diet. A lot of people think dairy can be a culprit. We'll get into that in a little bit with lactose. But, it is important to get that calcium in, and it doesn't have to be necessarily from dairy, from cow, but you can get it from plant-based milks too that are fortified. But again, the best, most absorbed is going to be from that, yogurt, cheese, milk. That's the highest sources of calcium in the diet. And the lactose-free versions are going to have just as much calcium in it. And then I'm just going to, mention about lactose intolerance. We saw a lot of questions about this. So lactose intolerance is something that, sometimes we see oftentimes, prior to and sometimes after diagnosis. So what happens is, our villi is the little hair-like projections in our duodenum, and with celiac, they get flattened. And in addition to the flattening of the villi, sometimes the lactase enzyme also gets diminished or decreased. And that is what causes that lactose intolerance with, the lactase enzyme naturally occurring in the duodenum is diminished or decreased again. But what happens is, once we start on that gluten-free diet, those villi start to grow back and that lactase enzyme comes back as well. And so we start to be able to tolerate lactose again in our diet. And oftentimes we see that lactose is not a problem. And sometimes, it may still be a problem. And this is not, not everyone, so some people can tolerate lactose after starting the gluten-free diet. And sometimes maybe it is still an issue. But again, we could still find really great lactose-free foods that are also calcium rich. They have nowadays lactose-free milk. You can get lactose-free yogurt. All hard-aged cheeses are naturally lactose-free. There's no residual sugars in there. There's also Lactaid, which is a pill you can take if you feel like that makes it easier on your, eating out and so forth. The diet. Oh, sorry. I missed the slide. So yeah, so we
No,
can
I
look
just
at the
thought
high
I advanced
lactose
it.
foods and the low lactose foods. So these are going to be from milk, yogurt, ice cream. The soft cheeses are going to have higher lactose. And then the low lactose are going to be the hard cheeses, and then these foods that have the lactose removed. And there's a lot of those on the market. And again, you can take the lactate pill if that makes it easier on you. But again, I think it's also important to, maybe you are on a lactose-free diet in the beginning, starting the, gluten-free, celiac, and then you are feeling better, the villi, you've been on the diet, and trying to add lactose back into your diet to see how your symptoms are. And if your symptoms are feeling okay, you feel good, then I say continue. It's always worth it to give it a try, and because it may not be necessary to stay on the lactose-free diet. We just want to remember dairy is a great source of calcium, vitamins, and protein. But there are non-dairy plant-based sources of calcium you can get from green leafy vegetables, seeds, salmon, lentils, beans, nuts, and then also the fortified plant-based milks are those are going to be a good source of calcium as well. And I think, is that the end of mine?
Yes, it is.
Okay. Great.
Okay. Okay. First I'm like, okay, it's a little stressful with me managing this. I'm like, okay. So I'm going to start on FODMAPs. So as Vicki started talking about, there are a variety of different kinds of carbohydrates. The acronym is FODMAPs, which are fermentable, oligo, di, monosaccharide, and polyol, which are just basically, as you can see with this bucket, I think this is a really good visual aid. If you think about the most common one, as we just discussed, is lactose. So anyone that's never even heard of FODMAPs knows of lactose intolerance, right? My grandma has it, my friend has it, somebody's got lactose intolerance you might know. We know lactose, if you do have it and you can't tolerate it, it's going to cause that kind of loud rumbling, gas, bloating, all of those symptoms. Well, it's not even been 20 years when they started researching this down in Australia, and they found all of these variety of other carbohydrates were highly fermentable. The next one they looked at was fructose. We'll go into each of these. Fructans are interestingly the ones that wheat, rye, and barley are located. So this is why many people might feel better on a gluten-free diet, even if they don't have celiac disease, because the overall load of what's causing gas and bloating in their GI tract might be lowered on a gluten-free diet. The fructans are also where your Brussels sprouts and cauliflower, garlic, onions are also located and are highly fermentable. We'll go into some other ones as we go on. Things that end with an OLS, those are those sugar alcohols, and those are highly fermentable. Those will be in things like sugar-free gum and whatnot. And then as Vicki already touched on, if you think about the commonly known beans, so those are the galactans. So, pinto beans, black beans, garbanzo beans, those are always been known to have some gassy side effects. So we do know those are the galactans. And so basically, Patsy Katsos, who's a registered dietitian, she kind of coined this whole bucket kind of term. If you think about, you wake up in the morning and you might have an empty bucket, right? And you might have a couple different things as the morning goes on, your lunch goes on, and midday you're feeling like, oh, I am distended, I feel like I'm pregnant, right? So it's more of the cumulative response for some of these different kinds of carbohydrates. So again, this was started down in Australia, as I mentioned. When you look at the overall low FODMAP diet, why we thought it was also important to kind of touch on this is the goal is not to say, oh, I'm on low FODMAP for life. No, that is not the goal. Because if once you reduce the fermentation in your gut, you might feel better, but we want to reintroduce some things back, because if we do not, that could actually have a negative effect on your overall GI flora, right? So if you think about your GI tract, you have this kind of like bacterial population, right? You have good and bad bacteria in there. And we want to increase the good and decrease the bad. And if we decrease so much of the things that ferment and could cause gas and bloating, that could have a negative response. And this was done even in a study with people who have Crohn's or colitis that went on this diet. And they found if they were on it for too long, it was not favorable. So the goal is ideally to work with a registered dietitian, if you can, because yes, you can eliminate some of these foods that we'll go into, but then we want to reintroduce them back. And then you might find, oh, if I have excessive amount of lactose or it's, too much garlic, that could just set me off, right? So that's the goal, is to have the most varied diet. And again, what's really interesting with this whole low FODMAP approach really is that it's been a very effective strategy for managing those who have this irritable bowel syndrome that's more on the looser end of stools, right? So if someone's having extreme constipation, we'll go into some of that. You will not necessarily benefit from a low FODMAP diet. Okay, so I will touch on that, but that's been kind of a caveat I've been working with a lot of individuals, because unfortunately, a gastroenterologist might say, oh, go on a low FODMAP diet. But if you are extremely constipated, this could actually make it worse, because it really is looking at things that we're going to reduce if you're having for more diarrhea. Okay, so again, I kind of touched on this when I was looking at the bucket, but if you think about fructose, so fructose is just a naturally occurring sugar that's going to be in certain fruits, specifically. So we think about honey, apples, pears, peaches, mangoes, all of those kind of fruits. Now, those have excess fructose. So what happens is, again, healthy overall for the GI tract to handle a certain amount of that, right? Now, I always remind people, and for myself as well, because for many of these things, say it's apple season or it's pear season, peaches especially, I could go crazy and eat way too many peaches or way too much of a volume of fruit over a course of a day, and will have a very, an odd effect from it, right? I might have, gas, bloating, whatever it might be. But so you think about that historically in your life, right? If you sometimes eat way too many cherries during the season, you are getting an influx of a lot of this kind of sugars that's kind of flooding the system. So sometimes it's the perfect storm in those individuals that have celiac disease. They might be exquisitely sensitive to some foods. And so I think it's being curious about this, not saying, oh my gosh, this list that these things, I have to avoid everything. No, that is not the goal, right? Now, certainly if you have celiac disease, you will have to always avoid wheat, rye, and barley, which are the fructans. So that's never going to be like reintroduced back, right? Or if someone knows they have hardcore, lactose intolerance, they're not just going to be testing the waters with regular milk. They don't really care to do that. They're just going to stick to lactose-free milk, right? So I like to often cherry pick out of the things that people might be doing very, very often. Now, I wanted to touch on the fact of fructose. Again, this could be like a 20-minute talk on some of these slides, that if someone is having bad constipation and they're saying, oh my gosh, I can't go. Well, hey, fructose and actually polyols will actually help you to go to the bathroom. They will actually pull water into the lumen of your colon, excuse me. And so fructose, so if someone's saying I have bad constipation, okay, eat fructose in your diet, right? So get in some of those things that will actually soften the stool. So again, I would think peaches, pears, the mangoes and things like that. Yes, apples have a little mixture. Apples actually have some of the polyol and the fructose in it. So those are things that could benefit you. And so instead of saying I'm going to go on a low FODMAP diet, I would say actually, so I'll give them this next slide here, and say, okay, I want you to eat those things that say excess fructose, because it says pull water into gut. I want you to eat excess polyol right now to see if that will pull more water into your gut to soften your stool, right? And so this is actually a handout from Kate Scarlatta, who's like the GI guru in IBS and low FODMAP diet in the US. And so this is kind of a handy dandy thing for a visual for a one-pager. It's not perfect. It's not, it's not complete, right? But this is a good for if, again, you're looking at some of the foods, if someone's complaining of major gas, bloating, cramping, abdominal pain, feeling like they're pregnant, the fructans and the galactans could certainly be driving that. I think another big one that people could overlook if they're having a lot of gas and bloating, I do this at least 3 to 5 times a week with patients. You go into what they're eating, and certainly they're eating gluten-free and stuff like that, but then they're using, and I use it too, but I, am aware of it. Sometimes things, garlic powder, onion powder, that's actually even more condensed and more potent than some of the other sources, right? So something like garlic powder, onion powder, since it's condensed and freeze dried, it has so much more of the gassy parts of it, right? So say if you're trying to eat heart healthy and you're using all this garlic powder, onion powder to not use a bunch of other salt and salty substitutes, you could say, oh gosh, I just feel so gassy. What is it? I feel like I'm not digesting. And you could just be ingesting a lot of these just gassy substances, right? And they seem very benign. It's a powder. And how could that do that, right? It's calorie, it doesn't have any calories. It's not, affecting my macronutrients. And we get so focused on things. So I think being very aware of sometimes it could be some small little fine tuning, especially if you're noticing you're having a lot of, GI symptoms and your, celiacs, serologies, blood work, all the things are, overall in normal levels. Hold on, I wanted to touch on, and then so back onto this slide too. So if you think about the polyols, those are going to be in things primarily like, this is often a big one, is sugar-free gum, sugar-free candies, things like that. So really being aware of, if you are somebody that chews a bunch of gum, has a bunch of mints, those are extremely fermentable. And sometimes just having somebody cut down on their 5 pieces of gum a day, they're a new person, right? So that, and then doing things like a lot of the different, some of the artificial sweeteners, those ones that end in the OL that are in other products as well. So those could be in different like natural shakes and things like that. So just keep an eye out on that. And then wanted to touch on that. Of course, if you think about something like high fructose corn syrup, something that would be in regular soda, that could really stir the pot, right? And so if you think about these FODMAPs, it's kind of like we went back to that bucket. It's kind of like the witch's brew, right? Like what kind of stirs my pot up that day, right? Because you could be eating, a couple things and be fine on one day, and then all of a sudden that set me off, right? So I think as Vicki mentioned, is maybe keeping a food log, and it doesn't have to be completely, perfect. The Monash University, they have an app, and I do recommend that for a lot of patients. You can keep a food log within the app, and it is like a one-time payment. I think the app is literally like $10, which seems like a lot, but it's a one-time payment, and it's like a book in your phone. I pull it up like every single day and utilize it. And what it does is it gives you kind of a red light, yellow light, green light when it comes to different foods. So say if someone realizes that they're really, fructose sets them off if they are having a lot of diarrhea. You can kind of go through each of the different foods and see what is high in fructose. So of course you can't probably see anything, but it's a red light, green light, yellow light. So if you look up Monash, and it's MONASH, we can send out the links for that as well later. But I just did want to touch on that because I think that even myself, I'm a registered dietitian. I have a certification, as does Vicki, from Monash University in Australia, with the low FODMAP diet. But I'm constantly learning and I can't memorize things. And so the goal again is to have like the most varied diet. And as I talked about, I think last time, is of like, trying to get like 30 plants a week, right? So not saying, okay, I only eat 5 things, a week. That's it. So the variety is key. And then this slide, I just wanted to again touch on the fact of like, there's so many different parts of it. When it comes to it, again, as dietitians, we go over like what somebody is eating, but again, for females, it could be, hormones. It could be, are you sleeping? Are you, stressed? All these different kinds of things, as well as men, right? So there could be a lot of different things that could be affecting some of this irritable bowel syndrome. And again, you want to rule out that you aren't having issues with as far as celiac disease or inflammation and things like that. But then looking at things outside of just only diet as well, because sometimes, this low FODMAP diet isn't the perfect thing either. This could be like a big, long conversation, but, sucrose is another type of sugar, and sometimes people have issue with that as well. So again, if you think about the overall considerations, really try to like think outside the box. Sometimes, yes, as Vicki mentioned, you could be eating a strict gluten-free diet. I had someone a couple months ago and they were legit eating like almost 50 grams of fiber a day, but like that's too much, right? So we want someone to eat 25 grams of fiber a day. But if you're eating 50, you might feel kind of bad because that's excessive, right? So we can kind of go really wild with it. And yes, you have a gluten-free sandwich. Well, you just had 12 grams of fiber on your 2 pieces of bread. And then you had all this other stuff, right? And so really kind of looking outside of that. And again, it could be, sometimes high fat foods, the caffeine, the lactose, all these different things that could really be stirring the pot. Another kind of behavioral thing is, chew your food, slow down while you're eating, watch that you're not like chugging a bunch of liquids with your meals, really being kind of in tune to that, because I think that sometimes can really drive a lot of GI symptoms too that we see. Think about eating out, someone keeps pouring water for you. You don't realize at the end of the meal, you feel like you're floating away. And it's hard for you to digest your food if you drink too much liquids, right? So I think being mindful of when your GI symptoms kind of hit. So in conclusion, just stay curious about your symptoms. And that is not always gluten, right? So a lot of times people go, oh my gosh, I ate at that restaurant. I swear I got gluten. Maybe you did get gluten, right? But was it some more of like an IBS reaction? Sometimes it's hard to tell that too, right? So I think stay curious, and you don't necessarily need to avoid so many things. Sometimes I talk to people and they'll say, I'm gluten-free, I'm soy-free, I'm nut-free, I'm egg-free, I'm free of all these things. And then you go into it and they may not need to be free of that, right? So the variety is the key. Speak up, be your own advocate, not one size fits all. Thank you again. I think we have some time for questions.
Yes, we do. Thank you so much, Lori and Vicki and
Yes.
Audrey. I really appreciate it. And Dr. Verma, I'm glad you're on as well. I would love, if we can, to start addressing questions. And I just wanted to talk, our first question. Well, Dr. Verma, do you want to go first before I get started? Do you have anything?
I just want to say, I think there are some people who may have joined this session and did not join the first one. So this is a part 2. So in case people are wondering why we didn't talk about wheat, rye, and barley, is because that discussion happened another time, and Rachel will send you the links when the email comes out to you at the end of the day. So I just wanted to point that out to people who may have joined for the first time, and hence the focus of this part 2 of our dietitians educating and teaching and answering our questions was really looking at what are the other things that potentially can come along as far as symptoms and things in the diet. And I know there's a comment here by one person towards the end about all these food restrictions and so on. And I think perhaps we start with that, if you would allow me, Rachel, is to go with that comment about promoting a lot of dietary exclusions like low FODMAP and so on. So Lori, do you think you could take that one in terms of these diets already so reduced, and here we are talking about many, many more diet restrictions and looking at
Absolutely. So I'm seeing that right now. So yes, and I think I touched on the fact that the goal is to have the most variety in the diet, right? The reason why I wanted to address this in this talk is that I am seeing excessive amount of patients being referred to me and saying, put them on a low FODMAP diet. So I wanted to address what is a low FODMAP diet. We don't recommend it for many of our patients. And if it is recommended, the goal is to get off of it as soon as possible, right? And again, for some people, it could be, I have so many people, and the only thing that they didn't even know they had an issue was lactose, right? They went gluten-free, and all of a sudden we're like, oh, and so that's their only thing, is they're watching lactose. So yes, we are not trying to promote any further restrictions. I myself have celiac disease, and I am always trying to push the barrier of what else my patients can include. So I wanted to touch on that just so people have a reference. And have some like real resources, because I know there is so much misinformation online that you have to feel like you have to avoid things. So the goal is the most variety possible.
Yeah, and I think, when you mentioned about going out to eat, I think it goes back again to where we don't want people to be restricting unnecessarily. So if you're going out to eat and you have symptoms, as you just heard from Lori, that it's not necessary that it has to be gluten, then there are so many other reasons why symptoms can come along. So keeping an open mind, a balanced sort of look at life is important as we go through with these diets. So thank you for that explanation. And hopefully people do understand that the idea is really not more restriction. It's more thoughtful process in terms of how do we manage our diet and stay healthy physically and psychologically. I think that there's both aspects to that in terms of our diet. So if we take another question, and then maybe Rachel, your question, there's a lot of questions about fiber. So Vicky, in terms of soluble, insoluble, how much fiber, how do we decide how much fiber someone needs? How do you counsel people? And are there any fiber supplements that you would say someone with celiac disease should stay away from? Any of those, just fiber in general, in a nutshell.
I mean, in terms of fiber, I always recommend getting fiber naturally from, a variety of fruits, vegetables. Again, variety is here. We don't want to eat the same fruit every day. We don't want to eat the same vegetable because they all have different amounts of fiber, different kinds of fiber, but variety of, again, fruits, vegetables, and then some of these gluten-free grains, quinoa. You can get it from, if you guys heard of buckwheat, amaranth, these are different really great gluten-free grains that are high fiber. And then also legumes, nuts, and seeds, and which are, again, are naturally gluten-free. So, I love, for kids, trail mix, obviously sometimes nut allergies come into play at school, but like you come home, you can get some nuts, peanut butter, sun butter, almond butter. These are great sources of fiber. Legumes, again, these can be, irritating. Beans cause gasiness, but in small amounts, minimal amounts, or even, putting them into salads or putting them into mixing them into with different proteins can also sometimes offset the side effects. But I love beans. I love, again, getting these from, a variety of foods. If you do, want a supplement, there's some supplements that we want to stay away from because of celiac. The ones that are made with like the wheat starches, which is oh my gosh, which
Flintstones.
I'm like I'm blinking here on the fiber supplement that has gluten.
Oh, the fiber
Benefiber.
Benefiber, sorry, I
Benefiber.
totally blanked. But
Mhm.
Metamucil is a good one. It actually is made with psyllium, and psyllium is actually, we know, is a good fiber source that actually is low FODMAP, and it is one of those, has lower side effects. So if you were to do a fiber supplement, if you feel like you can't get enough fiber from the naturally gluten-free foods, then you can supplement with Metamucil. You just want to make sure you do drink a lot of water. And then water is very, very important here. We all, that also can cause sometimes some constipation if we are dehydrated and not getting enough water. In terms of amount of fiber, it really depends on your age. And basically age, but in terms of children, depending on age, but I always say, age plus, oh my God, I'm blanking on this too, the fiber amount.
10.
10, yes. And then with adults, it's about 25 grams per day. Right, Lori? For adults?
Yeah.
And I
Yes,
think
25.
one of the things, I know, Lori, you mentioned about, 25 and then somebody ingests 50 grams of fiber. But do you think that if let's say an adult is supposed to have 25 to 30 grams of fiber and they've been doing 30 and then want to creep up to 30, 32, 35, is there a problem with that? Or is it just the speed at which we go up is the problem?
Yeah, I mean, I think it's the speed. And sometimes too, like this was someone that was complaining of a lot of gas and bloating, right? So then it's like, okay, well, let's see what you're eating. And sometimes you could be overdoing it, right? With really good intentions because I want to get more fiber in, but you could have a lot of gas and bloating. And I don't think even the bowel movements were that much better, right? So yes, it's kind of looking at all those things. That's why I was saying of like, even instead of saying to avoid certain things on low FODMAP, I think if you have constipation, I have patients that I literally have right now either doing 2 kiwis a day if they have constipation. There's studies on that. 2 kiwis help you to have a bowel movement, or they'll do like 5 to 7 blackberries or 2 to 4 prunes. Again, if they could tolerate it. Again, we do have, see some questions in here about gastroparesis. We do see sometimes the overlap of gastroparesis and celiac disease. We do see that. I see something about CVID, which is common variable immunodeficiency syndrome. We do see that with celiac disease. Again, a lot of these things are autoimmune related. Gastroparesis sometimes can go again with other autoimmune diseases. Or, even right now I have that with patients that don't even have celiac disease and they have gastroparesis and they don't even have diabetes. So I think yes, it's a challenging mix. And if you think about historically, I think people with celiac disease were always known to say, oh, they have diarrhea predominant symptoms, right? Where now we are seeing people who have severe constipation with celiac disease. So they're malabsorbing, but they're still having constipation, only having a bowel movement once or twice a week, right? But so it seems so counterintuitive. But so again, in those situations, I think if you are still having constipation and you've tried a lot of these things like even Miralax or Metamucil and you don't have much benefit, really
Oh, we froze.
for those 3 servings of fruit to see if that can help to soften your stools.
I also encourage sorbitol rich fruits too, which
Yes.
are lower FODMAP. So these also can help soften that stool as well.
Yes.
And again, getting back to that fiber is really, really looking at our diets. And that's again why we want you to be evaluated, see what you're eating, because we want to see, maybe you think you're getting enough fiber in, but a lot of times I come across with the kids I see they're not getting enough fiber in their diet every day. And then the liquids too are not adequate.
And Vicky, you mentioned liquids, and Audrey, I want to turn this question to you. What is the appropriate amount of water? And then can you address, I know Lori, you touched on it in your presentation about it being more difficult sometimes to digest food when you're eating a lot. Can you summarize, Audrey, goals for water, and then why, if you drink too much while eating a meal, it might cause problems?
Oh boy, yeah. There is a golden rule, much like the fiber, it's the age plus 10. I rely on a very mathematical method called the holiday seeker method, which I don't recommend you do. But what, off the top of your head, does anyone, Lori and Vicky or Dr. Verma, do you know that rule of thumb, the age plus something?
I only know age plus age is old. I
Age
don't
plus
know.
age is old, yeah.
I honestly don't know with the water part of it, but I know the fiber is 10. But I think, I sort of look at, again, I think adults would be different than pediatrics. But Lori, do you have a sort of guesstimate of how much? 6 liters, 4 liters, 2 liters?
And this is like per day, you're saying?
Per day, per day.
I mean, I think the one we usually say is like half an ounce per pound at least. You
That's
want
what
to
it was.
half an ounce per pound. Yes. And
That's
I
what it
think too,
was.
so like I have an ounce per pound, but then also like what I was saying about if my whole point of like with the liquids with a meal was more of saying if someone is telling me they're complaining of a lot of gas and bloating, right? And they're not chewing their food up, they're drinking a lot of liquids, they're seeing a lot of food in their stool. That's not helping with food. You want the food to drop into your stomach and get battery acid moved around, right? Not go, you chug 20 ounces of water with your lunch. That's not going to help with your overall, right? If you think about it. So it's fine to have liquids, but if someone's complaining of a lot of GI distress, right, start to just look at how am I eating and drinking. And, that was kind of my whole point of it. I'm not saying it's going to, minimize your ability to absorb things. I'm just saying it's not going to maximize your digestive processes.
Like anything, too much at once is going to cause issues.
Yeah.
So it's a habit we all have to learn to sip water gradually throughout the day. And if you can, aim for half your body weight in ounces. So, but there are lots of different ways too to encourage kids to drink water or eat more of their water. That's one that I like to recommend is if the kiddos can tolerate foods like watermelon, right, cantaloupe. Those are all really dense, water dense fruits that are fantastic. So again, talk to us about it. And specifically, if you're seeing your kids binge on a lot of processed foods specifically, because even though, like we said, the gluten-free diet is the treatment, it's a lot of processed food, a lot of food made with xanthan gum. If it's low in calorie, it could be made with something called allulose, which is a sugar alcohol, which can cause gas and bloating and distension. So we're aiming for foods in a gluten-free diet. We want to aim for foods that are out of the package. If there are foods in the package, that's fine. But the important thing is to balance it with fiber and water throughout the day and expand. Like Lori was saying, we don't want to keep the food the same. We want to broaden within our restrictions, and we can help you do that.
That's great. Vicky, can you address a little bit? Lactose is a very popular topic, I think, in our questions and pre-submitted questions. And I just wanted 2 things. One, can you identify the difference between casein like sensitivity and lactose And then also is this something with celiac, once you develop, go on a gluten-free diet, that can be prevented? Just how you kind of edge into, not prevented, but I know some people develop lactose intolerance. And so I just want to address that, and also the casein issue.
So casein is the protein found in milk. If you have an actual casein allergy, then you're allergic to the milk. The milk protein is the casein. So it's very different than lactose. So if you actually have an allergy to milk, then you can't have any dairy foods. And that's more of an IgE related, like you would have hives, swell up, or various things could happen. So that's completely different than lactose free. So lactose free is going to be those sugars, as I mentioned, that are hard to break down in the gut, and these cause the side effects of gas and bloating and so forth. And so the lactose, sometimes, obviously, in celiac disease, we can often see it. Sometimes it's more common because of those villi are damaged, but as we rebuild them, that enzyme gets rebuilt too. So oftentimes, when you start a gluten-free diet, you can start tolerating lactose again. And sometimes, though, however, outside of just celiac, we might have lactose intolerance. And this has nothing to do with celiac. It's just that enzyme, that lactase enzyme, could be diminished from other things, such as antibiotics or other things that could happen, traumas, different things. Our villi might not even just have enough. So that could be a separate entity of having lactose intolerance outside of just having celiac disease. And again, with lactose free, it's if you are lactose intolerant, in fact, it's different than dairy free. I always tell people who I'm educating on lactose intolerance, this is not the same thing as dairy free. So we can still have dairy foods. We just have to have the lactose removed. And again, that's going to be like, for instance, lactose free milk. There's a brand called Fairlife I'll throw out. I don't have any ties to them, but Fairlife is a great product. They add the enzyme back into their products, so it's lactose free. So they have milks and yogurts and lots of different products nowadays, and they're all lactose free. So you don't need to actually take, there's a lactide actual enzyme like you would buy over the counter that you can take if you're eating out and so forth, that you don't know if there's any lactose in the food you're eating, but you don't need to take the lactate enzyme if you're, drinking lactose-free milk. So does that answer your question?
Yeah, absolutely. Lori, I want to shift gears a little bit on your thoughts on
If I can just say one thing
go
about
ahead.
the lactose,
Yes.
I think it's important, like when I'm seeing my patients, it's very important for parents to understand that if a teenager wants to have lactose in their diet, even if they have lactose intolerance, that's okay. That lactose is not going to cause any damage. It's going to give them symptoms. They'll have belly aches and gas and so on. And if any of my patients are on, they'll hear me saying, well, don't complain to your parents then. If you've decided that you want to have the lactose and be done, I don't care. I want to be, I'll have gluten-free pizza, but I'm going to have regular cheese on it. That's fine. It's not going to cause any damage. It'll give you the symptoms, but it will not cause damage, unlike gluten, where we will not tell them, go ahead and eat gluten. So it's important for us to keep that in mind, that it causes symptoms, but not necessarily any damage to your intestine. Just again, I'm speaking on behalf of my teenage patients.
Yes.
No, that's so true. They want to go have milkshakes and then they're feeling, not feeling so great, but that, it's the symptoms that, it's not going to cause any damage.
Yeah, totally.
And I just wanted to, Lori, shift gears, and I'm trying to wrap up like a few final questions. Can we address your thoughts on probiotics?
Yeah, I mean, so it's a challenge. I think, sometimes it's like the variety of probiotics that are out there as far as pill form. Sometimes the growth media could possibly have gluten. So we usually ask to get like probiotics via food if possible. There are some various like liquid probiotics that are out there that they've done different studies with. But I think right now it's very hard to give like a global blanket of like, take this one pill, it's going to be like the golden ticket. So again, fermented foods or probiotic rich foods will also help with your overall gut bacteria. So I think including those, and again, if you think about those are the good bacteria, the probiotics, prebiotics are those fiber rich foods that we actually talked about. So all those FODMAPs that we were saying could cause more diarrhea, those are the prebiotics. Those are the good stuff. So garlic, onions, apples, all those things are prebiotics that feed your gut bacteria. So we want you to increase it via diet, which will help your overall bacteria. And hopefully we'll have more data on the probiotic pills and whatnot. It's just as far as celiac disease, those different pills could be a little bit risky. And so again, there's more to be determined on that in the future. I think there needs to be more studies looking at that.
Perfect. Thank you.
Yes.
Can someone, Audrey, do you want to address like chronic constipation? I know that there were a few questions pre-submitted about chronic constipation.
Yeah, it's so frustrating, and especially when it comes to celiac. But and what we're going to address, if you bring this concern to us, what we'll address is, of course, fiber in the diet, right? Are you really getting enough for your age? And water in the diet, are you getting enough for your body size? So, and if we find those two are you're getting enough every day, or you should be having a normal bowel movement, is the issue. Then we deal with a lot of withholding in children, and maybe intentional and unintentional, right? Maybe they forget to sit throughout the day and they're constipated because when was the last time I went poop? You know, who really thinks about it? So those are issues that we address in our visits together. But ongoing chronic constipation, despite all of these supplements, or if your doctor puts you on medications to try and target this, you know, ongoing chronic constipation, despite good adherence to the diet, good fiber, good fluid, good toilet sitting behaviors, could indicate an underlying issue. And you need to be sure to make a follow-up appointment with your doctor. You know, if we rule all these things out and one of these is helping a little bit, then we know we're on the right track. But if you're really giving this a good try and it's not working, we can talk about it more. Dr. Verma said one thing during an appointment, and I've used it ever since. She said, prove me wrong. Try these things. If it works, great. But if you're saying, Dr. Verma, I'm doing this, doing everything you said, and it's not working, prove me wrong. And then we'll talk. Sorry, Dr. Verma, I loved it.
I think it's important to remember that these things don't get better overnight. You know, if you've had constipation, whether you had constipation as a symptom that brought you to the diagnosis of celiac disease, or you started on a gluten-free diet and became constipated, again, I think it's been a discussion in terms of what's lacking in a gluten-free diet. It is not going to get better on its own. And just increasing the water, I'm sorry to say, ladies, the dietitians, it's not the answer. So you've got to do everything together. It's so important that you do the fiber, the water, the toilet sitting, and the medicines all need to be done together. You've got to do these things all together and give it time. A week is not going to get you even in the right zone of having a good bowel movement. So have patience, continue that, adjust the dose of your medications and so on with the help of your medical team, but have patience, and you've got to do everything every single day. Would you agree, Lori? It's the same in the adult
Yeah.
world.
And I always say, I literally call it like having a bowel regimen. And your bowel regimen, it could be like, you know, having that quiet time that you have something hot beverage to help you to go, right? So coffee or tea or hot water with lemon, you have to have a bowel regimen. You have to consider a squatty potty. I will not live without a squatty potty or something to put my feet up on, having a bowel movement. You have got to have that. Again, I went through this having constipation, getting diagnosed with celiac disease, being told you won't have celiac, you have IBS. So I've had horrendous constipation in my life. So yes, bowel regimen. And I have been the person that's done everything. And everyone's like, eat more fiber, drink water. And I'm like, I've been doing that. Right. So yeah. So I have definitely been on both sides. So I think it's definitely listening to the patient also being open to the different things, and then not just fiber, but what other fibers are going to pull the water into your gut, right? Rather than to say, eat more fiber. No, what type of fiber are you eating to actually pull the polyols, fructose into your gut? So that's my soapbox.
Bingo.
Thank you very much.
Yeah. And what I love is Lori and Vicki and Audrey and Dr. Verma have really illustrated tonight the importance of a team. And I think, you know, following up with your medical team, you know, going to your dietitian regularly when you're experiencing things, because I love what you just said, Lori. It's not just the fiber, it's what kind of fiber you're eating. And that's, you know, their expertise. And I think that follow-up And as you're managing diseases, whether it's celiac or IBS, other things, it's so important to see your team regularly. They, I think, can guide you through when there are bumps along your path. And I think that's just such an important thing. Dr. Verma, I want to be thoughtful of time of our guest speakers tonight. Is there anything else that you wanted to address with this crew? But I just want to say really quickly, having this part 2 was so amazing. So thank you for giving your time within a few weeks so that we could address more of these questions, because I know in our last presentation, which I will send out both, we will be sure to send you both recordings, but it was really a thorough, amazing presentation and we just couldn't get to everything. So Dr. Verma, I'm going to turn it to you before we wrap for the evening.
I know there are a lot of questions that we haven't answered, but I can tell you in general, all the things, the gastroparesis, the bile acid diarrheas, the POTS, CVID, these are all conditions that can be associated with celiac disease. It's not to say if you have one of these conditions, something else is going to be there for sure, but these are all associations. Along with SIBO, this is all associations that happen with anything that causes inflammation in your gut. So whether you have Crohn's disease, you can have any of these symptoms. Whether you have celiac disease, you can have any of these symptoms. So the key is you need to follow up, as Rachel said, with the team. But again, if your symptoms are not improving based on whatever you're doing as far as your therapy, it's important for your clinical team to hear you. And it's the same thing, it's very important from you as a patient or a patient's caretaker or their parent that you bring it to the attention of your clinical team, because there are so many other things that can be associated with that. So don't give up. If there are symptoms that are ongoing, bring it to your team, have your team listen to you, and keep an open mind. All these symptoms are not always related to gluten. So don't be fearful of going out to eat. It's really important that we are not fearful of going out to eat, but keeping an eye on the symptoms would be important. And I think that Lori and Vicky, who both have celiac disease, go out to eat. I have children. I have 2 children who have celiac disease. They go out to eat. So it's important that we go out to eat, but keep our minds open to other things that potentially can give a problem. So hopefully this has been educational for everyone. It's definitely been, I learned every single time I'm listening to one of the talks. So I thank you as well, Lori, Audrey, and Vicky. This has been great. And of course, to the audience and Rachel putting this together. So thank you.
Thank you. Thank you, everyone. We really appreciate your time. We're going to conclude this evening, but thank you. And we'll be sending out this recording very soon. And it'll be up on our YouTube channel as well. So thank you very much.